In a country of more than 110 million Filipinos, healthcare is a matter of life and death. But as our population grows, so do the challenges: long lines, underfunded facilities, and rising costs.
Public or private? What's the better choice? Today, we explore the current state of the Philippine healthcare system and the real difference between government services and private insurance. This is Pulse of the Nation.
Every day, thousands of Filipinos rely on government hospitals. For many, it's the only option. Public healthcare in the Philippines is primarily powered by PhilHealth, the National Health Insurance Program. PhilHealth aims to provide basic medical services to all Filipinos, but despite this promise, government hospitals remain overwhelmed, understaffed, under-equipped, and underfunded. Patients wait hours, sometimes days for treatment. Emergency rooms are overcrowded, and some rural health units still operate without basic medical tools. Doctors and nurses do their best, but the system is stretched to its limit. Yes, PhilHealth covers many costs, but not all. Medications, diagnostic tests, and specialist service often come without out-of-pocket fees, and for low-income families, even that's too much. Outside Metro Manila, the situation worsens. Rural areas lack access to specialist and essential care. Many must travel far just to see a doctor, or worse, delay treatment entirely.
On the other side of the spectrum is private healthcare. Fast, clean, and reliable. Private hospitals are often the gold standard in service, but they don't come cheap. Private health insurance companies like MaxiCare, Medicard, and IntelliCare offer HMO plans for individuals and employees. These plans cover consultations, diagnostics, hospital stays, and even mental health support. The process is much smoother, the wait times shorter, and the facilities more advanced. For those who can afford it, it's a massive relief. But there's a catch. These plans come at a price. Monthly premiums, annual limits, and coverage exclusions can still leave patients with hefty bills. And unlike PhilHealth, private insurance isn't universal. Millions of Filipinos, especially freelancers, informal workers, and the unemployed, are left out. Private insurance is a privilege, not a right. And in a country where many live paycheck to paycheck, it remains out of reach for the majority.
So what's the real difference between public and private healthcare in the Philippines?
Let's break it down. In this infographic, we can see that there are 5 categories in which we can see the difference between public and private healthcare in the Philippines. To the first category, accessibility. Under the public healthcare in the Philippines, it is universal for all citizens, made to be accessed by the public and also to anyone that has an emergency or a need for healthcare. Private insurance, on the other hand, is only limited to members and plan holders. Moving on to the second category, cost. Under the public healthcare, which is PhilHealth, it requires low to no premiums, subsidized. It is much more friendly to the much more less fortunate members of the community, while private insurance requires you to pay monthly and annual premiums. A much more requirement for the service that is given to you, you must be a wealthy member of the community. Third category, facility quality. The public healthcare in the Philippines often have basic and outdated facilities, whilst the private insurance have more modern, high-tech, and well-funded. Second to the last category, wait time. The public healthcare in the Philippines are often long and crowded, while the private insurance are short and efficient. Lastly, service coverage. Under the government, which is the public healthcare, it is basic and emergency services only, while the private insurance is a much more broad aspect in which You can consult them for almost anything because they have specialists in almost every single area.
The Filipino healthcare system is not broken, but it is bleeding. It's time to ask the hard questions.
Can we improve our public services so no one is left behind? Can we regulate and expand private insurance so more people are covered?
One thing is clear, health is not just a service, it's a human right.
And it's time we fought for it.
I'm VINZ CRISTOF.
And I'm Miguel Gabriel ACEDILlo. This is Pulse of the Nation. Thank you for watching.